Okay, we will now move on to our next speaker, who is here with us, Nishat from Hospital for Sick Children, who's going to talk about the contribution of white matter disruption to behavioral problems after concussion in children. Emin is a second-year PhD student in the Department of Physiology at U of T. She's co-supervised by Doctors Ann Wheeler and Stephanie Amias. Emin uses advanced diffusion MRI data to investigate changes in the brain microstructure following a childhood concussion and the relationship with emotional and behavioral problems. This talk will explore whether behavioral problems after a concussion are associated with pre-existing behavioral problems or with changes in the brain's white matter from pre to post injury. Ultimately, Emin aims to gauge the long-lasting effects of childhood concussions on brain development and mental health.
Hi, everyone. I apologize for that extremely long bio. So my name is Iman, and today I'll be presenting my talk titled Contribution of White Matter Disruption to Behavioral Problems After Concussion in Childhood. So according to the latest data from the Canadian High School Survey, 1 in 4 adolescents have experienced at least one concussion in their lifetime, with many children experiencing long-lasting behavioral symptoms beyond 1 month post-injury, with females at greater risk. These behavioral symptoms can include internalizing behavioral problems, for example, anxiety and depression, as well as externalizing behavioral problems such as aggression and rule breaking. These problems can influence their daily functioning and can also result in an overall poor quality of life. So different forces from the injury, such as the ones pictured here, can cause neuronal damage from shearing and tearing of axons, and this can disrupt brain development. As we know, brain maturation continues throughout childhood and adolescence. So as pictured here in the blue dotted line, we can see that white matter volume continues to increase after birth. And we can see that myelination begins shortly before birth, continues throughout childhood and adolescence, and then into young adulthood. This maturation is crucial for brain development, and a concussion early on can disrupt these processes, especially in the deep white matter pictured here in the red, as well as the superficial white matter fibers, which is pictured in the blue here. So these are the fibers that are closest to the cortical surface and are late to develop. Now, one of the biggest challenges with identifying how a concussion influences behavioral problems is the inability to dissociate the contribution from pre-injury behavioral problems from injury to the brain microstructure from the concussion. So for this project, I used data collected from the Adolescent Brain Cognitive Development Study, which is a US-based community sample of children that were recruited at the age of 9 and 10 years old. And the follow-up data, which was collected 2 years after study entry, we have a subset of 204 children that experienced a concussion after study entry. So we had both information from pre-injury and post-injury to answer these questions of how a concussion affects brain and behavior. So the behavioral data was collected using the child behavior checklist. So this is a parent report measure of a child's behavior in the last 6 months. And for the purpose of this presentation, I will focus on the internalizing behavior, which again includes anxiety and depression. And the diffusion MRI measure used for this study was neurite density, and 99 of the 204 children had usable brain imaging information from pre and post injury. So first, we focused on the behavioral findings. So when comparing the post-injury behavioral outcomes between children with and without a concussion, we saw that children that had a concussion had worse internalizing behavior problems. When we controlled for the pre-injury problems to ensure that any differences we see are not due to pre-existing differences, we found that female children with concussion had worse internalizing behavior problems compared to children that had not experienced a concussion. So that's shown on the left here. And there was no group differences seen in males. So this suggests that there is a biological factor that is influencing new behavioral problems in females after concussion. So then we looked at the brain imaging. The diffusion MRI sequence that was collected from the ABCD allowed a multi-compartmental modeling of the diffusion signal. So here we use restriction spectrum imaging, or RSI. So RSI is specific to brain microstructure because these images are acquired at multiple B values and diffusion directions compared to the conventional diffusion tensor imaging. So it can account for some of those crossing and bending fibers that we might see in white matter. So RSI defines the movement of water molecules in 3 ways, one of which is intracellular restricted diffusion. And this can be further modeled as spherically restricted diffusion, which would be within cells, and cylindrically restricted diffusion. So this would be within axons. So one measure derived from this is neurite density. And because of neurite density's ability to dissociate diffusion from extra-axonal diffusion from intra-axonal diffusion, it is said to be a more specific measure to the brain microstructure and may represent myelination, density of intact axons, or even dendrites within the white matter. Again, so I looked at neurite density in the deep white matter and the superficial white matter, and my results will focus on the superficial white matter, which is those short-range association fibers connecting adjacent gyri. So first, we measured typical white matter development over these 2 years, over this 2-year period. And so along the x-axis here, we have age, and then the y-axis is just the neurite density value. So we plotted the baseline and follow-up neurite density value for each individual participant. And what we see is a general increase in neurite density, which is associated with the expected development of white matter maturation. So this may be, again, myelination or increase in axon diameter or axon density. And we see the same for the concussion group. Next, when comparing change in neurite density between groups, we saw a group by age interaction, such that younger children with concussion had less neurite density over the 2-year period compared to children with no concussion. So we then did a sex stratified analysis with this group by age interaction term, and we saw that female children with concussion specifically, younger female children with concussion had less neurite density change over this 2-year period compared to children that had not had any injuries, and there was no difference seen in males. Next, to examine how deviations from this expected trajectory of white matter development is associated with the post-injury behavioral outcomes, we calculated a deviation score in each child with concussion. So along the x-axis here, I have deviation, and then along the y-axis is the internalizing behavior score at follow-up. So a negative deviation score suggests that the concussion group has less white matter maturation compared to the comparison group. A positive deviation score represents that the concussion group has more white matter development compared to the comparison group. And when looking at the association with the behavior, what we see is that female children that had less white matter maturation had worse internalizing behavior scores at follow-up, and this was not seen in males. Now, when we removed the outliers identified here, we still see this sex-specific effect where females that had less white matter maturation had worse internalizing behavior scores at follow-up. So in conclusion, what we found was that concussions result in internalizing behavior problems beyond those that exist before the injury. And we see new behavioral problems in female children with concussion specifically. We also found altered maturation of the superficial white matter in female children with concussion. And we saw that there was an association between worse behavior and less superficial white matter maturation in females, which suggests that this may be a biological factor influencing new behavioral outcomes post-concussion in females. Now, it's important to note that the ABCD study is not a clinical sample of behavioral problems or children with concussion, so future studies should aim to replicate these findings in a clinical sample. However, overall, with the use of the pre and post injury data, we showed that these results provide insight into the neurobiological mechanisms of increased prevalence of long-lasting symptoms in female children with concussion. The findings presented here are available as a preprint on bioarchives and can be accessed via this QR code. I'd like to thank Brain Canada for funding this project, as well as Dr. Wheeler's branch lab at C.E.T.S and the Kimmel lab at CAMH for their guidance on this project, and the organizers of this concussion symposium for allowing me the opportunity to present. Thank you.